Hi, Heather. Thank you for being.
Hello.
I'm so happy you're here with us. This is Heather Marra. She's a physical therapist and a pelvic floor specialist. And we have some really great questions to ask. Yes?
Yes, most definitely. Pelvic health is important.
Okay, so what is the pelvic floor? Like, how do we identify it? How do we know what's doing down here? Tell us
Exactly.
everything. Tell us.
It's more than just a black hole down there. And I brought my model. So let's talk about it so you know what it is because everybody has one. And this is the pelvis. This is my friend that comes with me everywhere I go and speak. So if you can feel your hip bones as you're sitting here, you can feel your hip bones on each side. You can feel your pubic bone in front. That's the bony space in front. You come down your back, and that's the vertebrae going down into your tailbone, and that's a tailbone. So if we look at everything inside of here, this is the pelvic floor. I forgot to tell you, these are the ischial tuberosities. So you sit on those. So those are kind of like the bony pieces, when you're sitting on a chair. So
Yes.
those are kind of our border of our pelvic floor. And if we look inside, it's like a bowl. So the pelvic floor muscles are three different layers and they contract and relax so they keep you dry from poop and pee. They allow you to poop and pee, and then they aid in sexual function. They also are your bottom of your pelvic or of your core. So think about your abs, your diaphragm, your back, and your core. It's a box, or I mean your pelvic floor. It's a box. It's a core. So we should be using it so it moves and relaxes and moves and helps us function really, really well. But we don't talk about it a lot. And it's doing a lot of help for us, or we're frustrated if there's some dysfunction along the way.
So tell me something, what happens to this area when we're pregnant? How does the pregnancy affect the pelvic floor area?
Almost definitely. So the uterus grows up to maybe 500 times its size. So you start out in your pregnancy, the uterus is inside. So this is the uterus here. Hold on. Right inside here. The cervix is at the bottom, and this is our vagina. So the uterus, which holds the fetus, starts to grow and grow. And around 20 weeks or so, that's when you start kind of popping out. And that's when it starts to come out of the pelvis, belly gets bigger. And so then you get bigger and bigger as the baby grows. And then there's pressure down on the pelvic floor. Your abdominal wall separates just a little bit, which a lot of women are like diastasis recti, or the separation of that abdominal wall. So there's pressure at different places. And so then the body accommodates to it. You have some stretch of your ligaments, and then you deliver. And then postpartum, then we work on getting everything strong again. So it does a lot of work throughout pregnancy.
So tell me, is there anything that women can do to strengthen these muscles or to protect the pelvic floor during pregnancy? Like, do you have anything you can tell us what to do? That's
Most definitely.
Mhm.
Most definitely. So it's a mobility and a stability key in pregnancy. Think about that uterus growing. There's ligaments. It's almost like a hot air balloon. And you think about everything growing pretty much every day, and you're starting to feel some of that tightness and discomfort and low back and posture changes. So, is it a mobility thing? Do we need to stretch just to feel better? I recommend getting like an exercise ball and sitting on that. And so you can do stretches, tilts back and forth. That way, we're helping our body maximize because I want you to be strong in pregnancy. And then there's some stability. So, yes, this baby that's almost like a watermelon that's sitting on your pelvic floor is going to take a lot out of you. And we use our back muscles. That's why a lot of times in pregnancy you have back pain, but you don't have to. We can do physical therapy. And so engaging the pelvic floor muscles with abs to pull everything in to keep you dry and stronger and feel better. So again, you may have heard of like Kegels. Those are pelvic floor contractions. but a lot of times 50% of women aren't doing them correctly. So that's where pelvic physical therapy comes in, because I would love to see a woman in her second trimester, third trimester, and delivery prep, and then 6 weeks postpartum. So again, you could be having some weakness and some leakage. You could be having some pubic pain or SI pain. And we work on that to figure out what we need to do. Do we need to mobilize? Do we need to stretch? Do we need to stabilize? And then we turn that corner around 35 weeks, and it's like, let's stretch everything and prep you for delivery. So it just depends what stage of the game you're in. But yes, you can use your abs, you can use your pelvic floor. Um, but you're not going to be doing sit ups and planks and things like that, but you can still engage those abdominal walls and that pelvic floor. So I kind of talk about like you're zipping up your pants and you want to tighten the pelvic floor into the abdominals, and you want to pull that all up and in. One thing I say is like if you're squeezing a blueberry with a vagina, that's a pelvic floor contraction. We're pulling up, or like a jellyfish. It's not pushing down, it's not pushing out, it's engaging those pelvic floor muscles.
Can you talk a little bit about having sex during pregnancy and what penetration or, the imagination just doesn't visualize what's actually going on in there with the pelvic floor and have
Mhm.
sex. Can you talk a little bit about that?
Right. As long as you're not having a high risk pregnancy and the doctor has said, oh, placenta previa, where the placenta is down low, as long as you're not on pelvic rest or bed rest or any restrictions, then you can go ahead and have sex during pregnancy. And it actually keeps the blood flowing, it keeps a strong pelvic floor. And again, you might modify your positions because we got a belly in front. So there are different positions to try and position so that you feel better and it's not hurting your hips or your back, or support with more pillows, but it keeps the pelvic floor healthy as well. Again, as long as the doctor's not put any restrictions on that.
Is there some way women can utilize the pelvic floor to increase the intensity of an orgasm?
Most definitely. So, research has shown that a stronger pelvic floor increases your greater chance to have an orgasm. So, strengthening those pelvic floor muscles, which, again, if you want to think about it, we talked about blueberries, squeezing with the vagina, or we talk about closing the elevator door and lifting up. Another one is squeezing around the penis during penetrative intercourse. So, when you're strengthening, it's not your butt, it's not your thighs, it's really squeezing. And if it's really hard for you to do, that's okay. We can learn this. Some of it is between the brain and the pelvic floor in neuromuscular reeducation, and some of it's strengthening. And again, pelvic PT can help you if you're like, I've tried and I'm struggling and I'm frustrated. But again, if we can pull that, we can have 3 different types of orgasms. Have you read that study?
No, no, I didn't.
So they put some surface electrodes on the pelvic floor muscles, and there they can be waves, avalanche, or volcano. So you can make that pelvic floor kind of tighten, relax, tighten, relax, tighten, relax orgasm. There can be a complete contraction of the pelvic floor into an orgasm, or it can be relaxed into an orgasm. So, and you could be a combination of all three. It just depends. Again, we as women are complicated and it varies from time to time. But connecting with your pelvic floor should help you make one, sex should be pain free, two, sex should be enjoyable. And we need to achieve that more and have these conversations. So it's not an uncomfortable conversation, or, well, that's just how it is, or mom just said, push through the pain, or doctor said, drink a glass of wine. Like, this is where we've got to get into pelvic floor physical therapy so we can address some of these issues, concerns, or questions about what's just good pelvic health.
Tell me something. A lot of us have heard the term prolapse, where
Mm-hmm.
it conjures up visions of our organs falling out of our
Yeah.
body or down. Is that possible? Is that what we're talking about? Like, what is that? What is
Yeah,
that?
it can be very scary. I know some women are just like, "Oh my goodness, I felt down there and there was a bulge, or I had a mirror and I looked down there." What's happening is the front and or the back of the vaginal wall is getting a little more lax. So the bladder can drop vaginally, or the cervix or the rectum. Again, it can come as a result of constipation for many years and bearing down, a result of after hysterectomy. It can be after birth. It can be with aging, going through menopause, and everything's just like, ugh, it's not like it used to be. So it's more of thinking about more of a laxity. So then we can strengthen the pelvic floor to optimize everything so that we can hold everything back in its correct position, avoid constipation. Again, I talk through, if you were my patient, I would be asking you lots and lots of questions about peeing and pooping and sex and pain and, all these pieces that's like, hey, I never put those two things together. Oh my goodness. And then we put those things all together and figure out what's the best solution. Maybe it's exercises, maybe it's vaginal estrogen cream in menopause to help regenerate the tissues. Maybe if we've tried pelvic physical therapy and we're like, let's not jump to surgery, there's supports, almost like a female jock strap that you could wear that would support from the outside, which would give you some pressure or support to relief. Ways that you can just lay down, put your feet up on the wall, and that just helps gravity come back. Or there's a pessary, which you go get fitted by your OBGYN, and they come in probably 40 different sizes, and they can be inserted vaginally to just push everything back in place. So then the pelvic floor can function and do its job better without that pressure feeling or that feeling like tampons falling out. And then if we need to, let's do surgery. But have we exhausted all these steps? Because I don't want you to go have surgery and repair of that prolapse and you don't know what your pelvic floor does. And guess what? That's like a Band-Aid fix. And then you go back to life and pooping and bearing down, and you're going to undo that surgery. So you want to be set up for success if we do surgery. And so that's why I always say conservative treatments are the best first. And then we decide what's going to be your best option.
I think a lot of women, when they're experiencing pain down there, they wonder what the dynamics are during penetrative sex with the penis.
Right.
Does the penis actually knock anything around down there inadvertently, or is there danger having sex if this is going on?
Right. So what I would say in an ideal situation, the vagina takes on the shape of the penis takes on the shape of the vagina. So it's a beautiful way that we're made and created. But if there's pain, it can be dyspareunia, which is pain with sex. One of the causes could be vaginismus, which is an involuntary contraction of the pelvic floor muscles. Again, some women are like, where did this come from? I don't, some women say, oh, yeah, I've had surgery. Some women have said, oh, I've had abuse. There can be a reason or there doesn't have to be a reason. So we don't have to chase that why. But if we know that there's tension and you feel like the penis just hits a wall, that's where there's tension around this vaginal opening. And again, it could be here or it could be deeper in. And as a pelvic floor physical therapist, I assess those muscles. So I evaluate you. I use gloves and gel on my finger and I look at the outside, and then I go internally. If there's a point of pain, we need to relax those muscles, just like we would a tight muscle. These just happen to be down on the pelvic floor and we're just not comfortable talking about it. But we must take care of the tension to relax. And if we push through the pain, our brains go, oh, he's part of the pain. He's part of the problem. I'm going to be tighter. I'm tighter. Like women tell me, oh, we just push through the pain. I'm like, no, 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 no. We've got to build this trust up. And then as I work with couples, then it's, let's go back to stretching. What's going to be best? Do you want to do the stretching yourself? Do you want your husband to help you do the stretching? Do you want to use a pelvic wand? I'll do some stretching on your pelvic floor as well, and then guide you through that along with breathing and appropriate lubricants and putting all those pieces together. So there's so many different factors that have to be looked at. And again, sometimes we're uncomfortable and we're just like, I don't want to, I feel embarrassed and I don't want to talk about it. So we need to get that concern out there and then go get help. And if your doctor dismisses it and says, oh, drink a glass of wine, I'm like, no, 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 no. The problem's not here. The problem's down here on the pelvic floor, and there is tension, and we need to help um, take care of it so that you can enjoy sex and it's enjoyable. It's not pain free and it just strengthens your marriage. So it's very, very important.
Can you talk about and maybe guide us a little bit about what would be the preferred positions if we get ourselves, like if we do have some pain and we do
Mhm.
feel like something's not right down there, like what would be a good couple good positions that we could be in that would be in
Right.
here?
Well, even before that is stretching, sitting on a heating pad, taking a shower. I mean, life is crazy. We've got kids, life, jobs, things. So if we're like, come on, let's just do it. Like women, we need foreplay. We need to help get that area relaxed. And then positions like if you're on your back, put pillows underneath your knees on the side. That way you're more relaxed, more than strained. Some women, as we've done the stretching and we're ready to attempt sex, we say, okay, communicate pain free. If it's painful, we stop. If you're on top, then you can control the depth and speed of penetration. And you can say, oh, that's starting to hurt. Or, oh, I feel that I'm tensing up. Can we stop for just 1 second? Let me breathe. And then take it from there. So those are two positions, and it's going to be different from person to person. But that way you can start there. And again, you got to be really relaxed, just be able to let go rather than guarded and this is going to hurt. So taking an inventory of what's going on. And then as you've achieved pain free sex in those positions, then you can achieve other positions. But let's start with the basics so that we can, again, we're building trust. We want those pelvic floors to relax and accept, and then the penis can insert.
Wow, this is really great. Can you just, we're getting towards the end here, but could you just go over a little bit about what a woman can do after a C-section? I just can't imagine. Here you are cutting into this area. Like, does it affect the pelvic floor? What areas does a C-section affect? And like, how can we like get, more in shape after that's, done to
Definitely.
us? Yeah.
So some women think that if I have a C-section, I'm saving my pelvic floor, but you're still carrying a baby for about 40 weeks. So that's a lot of pressure. Postpartum, again, I would love to see every woman 6 weeks postpartum go see a pelvic floor physical therapist. You see your doctor, and that's quick visit. Is everything going okay? Yeah, great, good. Return to life and sex. And you're like, whoa, wait a second. So then I would assess that scar because that's 7 layers that have been cut. It's a major surgery. And I think we as a society kind of dismiss it like, okay, yeah, yeah, yeah. But it's major. I mean, think about having a knee replacement. That's a surgery. Think about this being a surgery. Every time there's a layer of incision, the body heals and there's scar tissue. Thank you to the body, but sometimes it's too much and it can restrict on the bladder underneath.
Uh,
So we don't want to cause like urinary retention where I can't get my bladder empty. And often women are not instructed on scar massage. So I'll show you how to do a scar massage and move that whole belly. I'll assess the whole belly because again, we are out here and then boom, delivered. And the body just needs a little more TLC just to release some of that restriction so you can breathe and move scar tissue. And by the way, it's never too late to do scar massage because I've worked on scars 20 and 25, 30 years old, and we're still making changes. So, scar massage is the biggest thing. And sometimes women return to sex and it's painful after a C-section. Wait a second, why is that involved? Again, there can be tension, there can be restrictions. And again, that's where we assess as a pelvic floor physical therapist to make sure that the pelvic floor is moving and the belly is moving. Does that make sense?
it makes so much sense. It's so important. Just one more.
No.
How is reconstruction done down here? Like, what are we reconstructing exactly? Like, Is it the external part? Is it the internal part? What is actually happening when we go for reconstructive surgery down there?
Right. So, again, some women may have had a mesh or a sling, or you go internally. Often it's laparoscopic. So you might have like just some incisions on your belly, but they're pulling that bladder back, or they're pulling the cervix up with the uterus, or pulling the rectum back. So it's more in its optimal position. So it's like I might be able to feel the mesh as I'm palpating internally, but we're trying to pull everything back to its ideal place because with time, weakness, and ligament laxity, things have dropped down. So it's like we know that everything should be up in its correct spot, and so that's what's happening with a general information about a repair for prolapse or incontinence.
Well, thank you so much. Would you give the audience a way to get in touch with you? You know,
Definitely,
tell us.
definitely. So my website is one simple step dot today. I founded this years ago so that I could help women go from pain, fear, and confusion to freedom, confidence, and living. So one simple step dot today, because you can't do everything, but you can do one thing to feel better, take care of you, and that's essential. You can also find me on YouTube or Instagram at one simple step today, or email me at Heather at one simple step dot today. And I love doing virtual visits with women across the world, really around the world. And that way we can do birth prep. Can you go into birth different? A marriage prep. Again, I go into more details so you can understand what's going on, or pelvic health, what's going on with my body. And so, or seeing, and that's more of pelvic health visits. But I am licensed in the state of Kentucky, so I can see you in the state of Kentucky, either virtually or in person in Lexington, Kentucky area. I take my treatment table to women's homes and I go and see them there. So that's what I offer as a pelvic PT. I love it.
Such a pleasure to meet you and talk to you again. Thank you so much, Heather. Thank you.
Thank you.
Thank you.
Stop recording.
Stop recording.